presentation, we will discuss the mental health disorder, autism spectrum disorder. In this unit, we will discuss a number of mental health disorders, their pathophysiology, etiology, signs and symptoms, risks, possible complications, treatments, nursing care, and various theories. The specific disorder addressed in this presentation is autism spectrum disorder. Autism spectrum disorder refers to a group of lifelong neurodevelopmental conditions that affect how a person communicates, interacts socially, and processes the world around them. These conditions begin in early childhood, usually before age 2, and continue throughout the individual's life. The term spectrum is used because symptoms and abilities vary widely. Some individuals need significant support in daily living, while others function independently with mild social or behavioral differences. As nurses, it is essential to understand that autism is not caused by poor parenting or emotional trauma. Instead, it results from differences in brain development and function. Autism is more common than many people realize. It affects about 2% of the US population, and males are diagnosed approximately 4 times more often than females. Research shows that brain imaging and neurobiological studies consistently demonstrate differences in brain structure and activity, especially in areas responsible for social communication, language, emotional processing, and sensory regulation. These findings support the classification of autism as a biologically based condition rather than a behavioral choice. The exact cause is not fully understood, but genetics play a major role, along with prenatal factors such as maternal infections, advanced parental age, certain genetic syndromes, and exposure to medications like Valproate during pregnancy. The 2 primary features of autism include challenges in social communication and restricted repetitive patterns of behavior. Social communication difficulties may appear as trouble understanding nonverbal cues, such as facial expressions, gestures, tone of voice, or personal space. Children may struggle to form age-appropriate friendships or may prefer solitary play. Many also have difficulty interpreting the emotions and perspectives of others, which can make social relationships confusing or overwhelming. These challenges often continue into adulthood. Restricted and repetitive behaviors vary widely and may include strict routines, intense interest in specific topics or objects, repetitive body movements, or sensory seeking or sensory avoidant behaviors. Some children may become distressed by changes in their environment, unfamiliar situations, or disruptions in routine. These behaviors are not misbehavior. They represent the individual's way of coping with sensory overload, anxiety, or difficulty processing information. As nurses, recognizing these patterns helps us provide more patient-centered care by anticipating triggers and responding calmly and supportively. It is also important to remember that individuals with autism may have strengths such as attention to detail, strong memory skills, or deep knowledge of specific interests. Approaching care with respect, patience, and consistency promotes trust and helps support their communication needs. Families may face stress due to the demands of daily care, so compassionate family education and advocacy are key parts of our role. Regarding therapeutic measures for autism spectrum disorder, it is important to remember that early, consistent, and individualized interventions make the greatest difference in developmental outcomes. Autism cannot be cured, but evidence-based therapies can significantly improve communication, behavior, daily living skills, and overall functioning. Early intervention services, especially those initiated before age 3, take advantage of the brain's highest level of neuroplasticity. These programs help children build important foundational skills such as social engagement, language development, motor skills, and early learning behaviors. Nurses may assist families in accessing early intervention programs, which are federally available through IDEA Part C and offered at no cost to eligible families. Applied behavior analysis, or ABA, is one of the most researched and widely used therapies for ASD. It uses structured reinforcement to encourage desirable behaviors and reduce harmful or interfering behaviors. ABA therapy focuses on improving communication, social skills, academic abilities, and activities of daily living. Although ABA can be highly beneficial, it must be implemented by trained professionals and individualized for each child's needs. Nurses observe therapy outcomes, collaborate with families, and help reinforce skills during daily care. Occupational therapy is another core intervention. OT helps children develop skills needed for daily routines such as dressing, feeding, hygiene, and navigating social interactions. Many children with autism struggle with fine motor skills, handwriting, self-care tasks, or transitions between activities. OT uses structured techniques to improve independence and sensory processing. Sensory integration therapy is often a key component of OT services. Many children with ASD experience sensory processing differences, meaning they may be overly sensitive or under-responsive to sounds, lights, textures, or movement. This can cause distress, avoidance behaviors, or difficulty participating in daily routines. Sensory integration therapy helps children learn how to regulate these responses so they can better tolerate and interact with their environment. As nurses, understanding sensory triggers helps us create a calmer, more supportive care environment. Speech therapy is essential for improving communication, whether the child is verbal or nonverbal. Speech-language pathologists help children develop expressive and receptive language skills, social communication skills, and alternative communication strategies if needed. Some children use sign language, picture boards, or communication devices. One well-established tool is the Picture Exchange Communication System, or PECS, which allows children to communicate their wants and needs by exchanging pictures. As nurses, using the child's preferred communication method increases trust and reduces frustration. While there is no medication that treats the core symptoms of autism, medications can help when children experience co-occurring conditions such as irritability, aggression, hyperactivity, anxiety, or self-injurious behaviors. Currently, the FDA has approved risperidone and aripiprazole for irritability and aggression associated with ASD in children. Other medications, such as stimulants or SSRIs, may be used to treat ADHD symptoms or anxiety when appropriate. The nurse's role includes monitoring for side effects, supporting adherence, and communicating changes in behavior or mood to the care team. Finally, family support is essential. Autism affects the entire family system, and caregivers often experience stress, burnout, or difficulty accessing services. Support groups, community resources, and organizations such as Autism Speaks, NAMI, and local developmental disability services provide education, advocacy, and emotional support. Nurses play an important role in connecting families to these resources and reinforcing that they are not alone throughout the care process. This concludes the presentation. Thank you.